Come in.
Performing hand hygiene, providing my patient privacy. Hi, my name is Leslie. I'm going to be your nurse today. I'm going to be doing your head to toe assessment. This should take me approximately 20 minutes. A head to toe assessment is done to assess your body systems, make sure that everything is normal. I'm going to be explaining everything that I do as I go along, so if you have any questions, you can always just ask me. I'm going to be listening to your breathing sounds, your heart sounds. I'm going to be feeling on your lymph nodes. But again, there's going to be many more things, and if it's okay with you, I'm going to have to touch you for this assessment. So is that okay?
Yes.
Okay, so now I'm going to have my patient state their full name and date of birth.
Nadia Casala, 8/17/2000.
Okay, I'm going to ask you a couple questions now. What's your name?
Nadia.
Do you know where we're at?
The hospital.
Do you know what time of day it is?
It's 9 o'clock at night.
Okay. Now I'm gonna, the patient is alert and oriented ×4. The patient's hygiene is good. There are no abnormal smells coming from their body. Their posture is upright. The patient seems relaxed. Their skin tone is matches their ethnicity. So now I'm gonna go ahead and assess my patient's head. I'm gonna start off by feeling the head, making sure that there is no skin breakdown, no cuts, no bruises, no parasites, no alopecia. And from feeling the patient's head, I don't feel any parasites like lice or any alopecia or skin breakdown. Everything seems normal. The hair is spread equally throughout the head. Now I'm going to have my patient close their eyes, and then I'm going to have you puff out your cheeks, frown, frown, smile. Okay. I'm gonna have you close your eyes again, and I'm gonna touch you on your face and let me know when and where you feel my finger, okay?
On my cheek. On my other cheek. My chin. My forehead.
Okay, good. Now I'm gonna have you clench your teeth and then open your mouth and then move your jaw side to side. Okay, good. My patient's cranial nerves 5 and 7 are intact. Now I'm going to be moving on to my patient's eyes. I'm going to start off by inspecting the eyes from the outside, making sure that there's no redness or drainage coming from the eye. And I'm going to start off by looking at the patient's conjunctiva, making sure that it's nice and pink. Now I'm going to look at your pupils. I'm going to have you look straight ahead. Keep your eyes straight. Pupil is a 5. It constricts to a 3. And that one constricts to a 3 too. Now I'm going to have you look straight at my pen light and then just follow the light with your eyes. Okay, good. Now I'm going to have you stand up. I'm going to have you face that wall. Okay, I'm going to have you place one hand over one of your eyes. And then let me know when you can see my fingers.
I can see your fingers.
Okay, now do the other one.
I can see your fingers.
Okay, now you can sit down again. And now I'm going to be doing the 6-point check. So just make sure to look at my light and follow it only with your eyes without moving your head. Okay, good. From assessing the patient's eyes, I can tell that the pupils are equal, round, and reactive to light and accommodation. The pupils constrict correctly to the light. The conjunctiva is nice and pink, and there's no redness or drainage coming from the eyes. So cranial nerves 2, 3, 4, and 6 are intact. Now I'm going to move on to the mouth. I'm going to start off by assessing the lips, making sure that there are no sores or bruises on the outside, and her lips seem okay. So I'm going to have you open up your mouth, and I'm going to look inside for any sores, any broken teeth, any cavities. I'm going to be making sure that the oral mucosa is nice and pink, and I'm going to have my patient say, ah.
Ah.
And now I'm going to test the gag reflex. Now I'm going to have you look up and then swallow. Okay, good. From after assessing the patient's mouth, they had no sores in the mouth. The oral mucosa was nice and pink. The uvula was midline to the patient's mouth. The tongue was midline as well. There were no broken teeth. No cavities were noticed. So cranial nerves 9, 10, and 12 are intact. Now I'm going to move on to the patient's nose. I'm going to start off by making sure that it's midline to the patient's face, and it is. Now I'm going to have you close down one side of your nose, and then take a deep breath. And then do the same with the other side. Okay, and I'm going to have you look up. And then I'm going to look inside for any redness or drainage. Okay, good. There's no redness or drainage coming from the nose. There are no deviations noticed. The patient's airway is clear on both sides, so cranial nerve 1 is intact. Now I'm going to start off by looking at the ears. Just making sure that they're equal on both sides, that they're equal to the patient's face, that they're not that they don't have any cuts or bruises, any drainage coming from the inside of the ear. And I'm going to look inside now. Okay, good. Patient's ear looked good. The tympanic membrane is normal color, which is gray. There is no redness or drainage coming from the ear. The ears are equal on both sides. So now I'm gonna have the patient close their eyes and tell me when and where you hear my fingers.
I'm on that side. Right.
Okay, good. Patient's cranial nerve 8 is intact. So now I'm gonna move on to the lymph nodes. I'm gonna be touching your lymph nodes, looking for any tenderness, any pain. So if you feel any pain while I'm touching them, let me know. So I'm gonna start with the preauricular, postauricular, occipital, posterior cervical, anterior cervical, tonsillar, submandibular, submental, supraclavicular. Okay, all her lymph nodes are intact. She didn't state that there was any pain upon touch, so that's normal. Okay. So now I'm gonna have my patient stand up, facing sideways. And I'm gonna be measuring her anterior, posterior to transverse diameters, and they are normal. The ratio is 1 and 2. Now I'm gonna have her face that wall, and I'm gonna have you bend over. I'm gonna check for spinal alignment, making sure that their spine is aligned and her spine is vertically aligned and straight. So now I'm gonna have her sit on the stool facing that way. Wait, facing this way actually. There. And I'm gonna start off by palpating her back. Let me know if you feel any pain or tenderness. Okay. Now I'm gonna have my patient, I'm gonna check for the vibrations. So I'm gonna have my patient say 99 each time they feel my fingers.
99, 99, 99, 99.
Okay, good. Now you can have a seat back up on the bed. The patient's vibrations were normal. Oh wait, I'm gonna have you sit down again. Sorry.
Which way?
Facing that way. And I'm gonna be checking for thoracic excursion, so I'm just gonna have you take a deep breath. And then again. Okay, good. The patient's thoracic expansion was good. And I'm gonna have you sit on the bed, facing this way. I'm gonna start off by palpating your carotid pulse, one at a time. Okay, good. And now I'm gonna listen to her carotid pulse, checking for any bruise with the bell of my stethoscope. Okay, good. There was no bruise heard. Now I'm gonna be listening to my patient's breathing sounds using the diaphragm of my stethoscope. I'm gonna start in the apex. 1, 2, 3, 4, 5, 6. Okay, and now I'm gonna have you turn around, facing this way.
Oh, that way?
Yeah. Now I'm gonna be listening to the lung sounds from the back. I'm gonna have you breathe in each time you feel my stethoscope. I'm gonna start off in the apex again. 7, 8, 9, 10, 11, 12, 13, 14. Okay, good. Her lungs sound clear. Now I'm gonna listen to her heart sounds. I'm gonna have you just sit forward. Okay, I'm gonna start off at the second intercostal space, right sternal border, aortic valve. I'm gonna move on to the left sternal border, second intercostal space, pulmonic. I'm gonna move on to the third intercostal space, left sternal border, Irvis point. Now I'm gonna move on to the fourth intercostal space, left sternal border, tricuspid valve. And now I'm gonna go up to the first intercostal space and count down 5. 1, 2, 3, 4, 5. Mid-clavicular line, mitral valve. Heart sounds sound good. S2 and S1 are present. There were no more murmurs heard. Now I'm gonna assess my patient's abdomen. So I'm gonna have them lay down. And for the purpose of the video, my patient's gonna be keeping their sweater on. I'm gonna start off by inspecting the patient's stomach. The skin is even throughout. The belly button is centered to the stomach. There is no discoloration throughout the stomach. There are no visible hernias or bruising. So now I'm gonna ask you a couple questions. When was your last bowel movement?
Today.
Are you having any trouble urinating?
No.
When was your last menstrual cycle?
I'm currently on it.
Okay. Now I'm gonna start off by listening to the patient's bowel sounds. I'm gonna start at the right lower quadrant. I'm gonna move up to the right upper quadrant, left upper quadrant, left lower quadrant. Okay, good. Bowel sounds are normal. Now I'm gonna palpate the abdomen. I'm gonna start off with light palpations. If you feel any pain, let me know. I'm gonna start off with the right lower quadrant again. Moving up to the right upper quadrant, left upper quadrant, left lower quadrant. Okay, and now I'm gonna do deep palpations using both hands. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, good. I didn't feel any signs of distension or tenderness in the stomach. Now I'm gonna have you sit back up and I'm gonna check my patient's pulses. I'm gonna check the carotid pulse again, one at a time. And then now I'm gonna check brachial. And I'm gonna move on to radial. I'm gonna check the posterior tibial, dorsalis pedis. Good, pulse is strong. And now I'm gonna have you stick your hands out, and I'm gonna check for any edema, any tenderness. Let me know if you feel any pain. Okay, no signs of edema or any tenderness. Temperature is normal to the patient's body, and there were no deformities present as well. Now I'm gonna have you stick your hands out, and I'm gonna be checking the capillary refill. Good, less than 2 seconds on the hands. Less than 2 seconds on the feet. Now I'm gonna have you stand up. I'm gonna have you stand right here, and I'm gonna have you walk over that way. And then I'm gonna have you walk back 1 foot in front of the other. Okay, good. Patient's gait is intact. Now I'm gonna have you move your hands like this. Kick your feet out. Up and down. Okay, patient's range of motion is good. Now I'm gonna have you sit back down. And I'm gonna check the patient's strength. So I'm gonna have you squeeze my fingers. Okay, good. I'm gonna have you stick your hands out. And don't let me push down. Don't let me push up. Don't let me push in. Don't let me push out. And then same thing with your legs. Don't let me push down. Don't let me push up. Don't let me push out. Don't let me push in. And now with your feet, don't let me push them down. Don't let me push them up. Okay, good. Patient's strength is good on all 4 extremities. Now I'm gonna have you shrug your shoulders. Shrug your shoulders. Okay, and now I'm gonna do the same thing. I'm gonna try to push your head that way. Don't let me push it. No, this way. Okay, good. Patient's cranial nerve 11 is intact. And this is the end of my assessment. The patient was normal throughout, and I'm gonna go record my findings. Thank you for participating in today's assessment. If you have any questions, just let me know, and I'll see you later.
Okay.